Hello, I'm Dr. Frank Veltri. Today I'm going to talk to you about heart disease. What we're talking about is narrowing of the coronary arteries that eventually leads to loss of circulation to the heart, which can lead to heart attacks or heart damage over time. It starts probably when we're teenagers, or certainly in our youth, at least in the United States, and progresses over time. As the arteries get narrower and tighter, then the person may start having symptoms. Symptoms would be things like chest pain with activity especially. So when a person walks, that's what I'm concerned about. Walking, person having chest pain or arm pain as they walk, and then that's relieved by rest, and they walk some more and the pain comes back as the arteries get narrower. If it progresses further, when a person has a heart attack, what happens usually is the artery clots off. That narrow spot clots off with a combination of platelets and other clotting factors, and the person then has pain that won't go away by resting. Risk factors would be age, which we can't do much about. Usually older people tend to have more risk factors with heart problems. Gender, women are protected somewhat until they hit menopause from hardening of the arteries. Then there's things like high blood pressure, which we can do something about, smoking, which hopefully people will stop, diabetes, which can be controlled, lack of activity or exercise. Stress will certainly possibly trigger a heart attack, so stress is a problem that we have difficult controlling. And certainly a family history of heart disease makes a person more susceptible to having trouble. Or if a person knows they have blocked arteries somewhere else, for instance a stroke or poor circulation of the legs by blocked arteries, then that would make them at higher risk to have hardening of the arteries in the heart as well. Some of the signs of this would be typically pain, which was described as a crushing or squeezing type of a pain, particularly with activity, would be one of the main signs of hardening of the arteries or coronary heart disease. It doesn't always have to be the chest, it can be the neck or the arm, could even be the back, but typically we think of a pressing or squeezing pain with walking in the chest, arm, or neck. Those would be signs that maybe the arteries are blocking off, you need to have evaluated. There's other signs. Not everybody has those signs. Unfortunately, especially diabetics or women don't have quite the typical signs of that. Sometimes it's just unusual fatigue or nausea or shortness of breath. Now those are pretty vague symptoms. Most people have shortness of breath as something else, but it could be hardening of the arteries. An EKG, if a person is having chest pain, can tell us possibly if it's blocked arteries right at that point. Otherwise, if a person is not having chest pain at that moment, we would think of doing something like a treadmill or possibly a nuclear scan study to evaluate if that person has significant other symptoms. A treadmill is the basic test to look for blocked arteries for a doctor. That progresses to nuclear scans as a mid-level, and the final gold standard is to do the shooting of the dye, the angiogram that's done to evaluate whether there's blocked arteries. One of the other things that we can do to screen for coronary heart disease would be called vascular testing. They're going to do a combination of checking the arteries in your neck, along with checking for abdominal aneurysm and checking the circulation to your legs or the blood pressure to your legs. Those would be screening tests. That's not directly looking at the heart, but if you've got blocked arteries in one place, one can assume there's a chance of blocked arteries in the heart. The doctor would think about whether we need to do more investigating in that area. What are the treatments? Well, obviously the treatment is to improve your lifestyle first, to stop the smoking and the cigarettes, get the blood pressure controlled, control diabetes, those kinds of things, exercise regularly. But then the doctors would add medical therapy. Now, before we did a lot of stents and bypass, mostly it was medical therapy years ago. Medical therapy being things like nitroglycerin, aspirin, cholesterol-lowering pills, and control the blood pressure, diabetes type things. And if there's significant blockage, persons often end up with a stent. A stent is a little metal device placed through the blocked area to open up the arteries. If a person has more extensive problems, then they may end up with coronary bypass surgery. What can we do to prevent having to have coronary bypass surgery? Well, that gets into healthier habits, healthier eating habits, exercising properly, under your doctor's guidance, stopping smoking, weight loss, blood pressure and diabetic control that I've mentioned before, and the medications that are needed to control some of those risk factors. I hope this has answered some of your questions today. This is Dr. Frank Veltri for Living Well. Take care.